All right, let's take you back to our previous story. We were telling you that the federal government has detected anthrax in Nigeria for the first time in animals. Now, I have joining me Dr. Bala Mohammed. He's the governing board for the member of the governing board for the Veterinary Council of Nigeria. And he joins me now from Abuja. Dr. Mohammed, it's good to have you join us right now. The word anthrax, thank you. The word anthrax could seem really scary, especially when we cast our minds back to the experience from some countries. But how concerned should Nigerians be as much as this is amongst animals?
Okay, thank you. I think we should be very concerned, and we are really very concerned as professionals because if you look at the population of livestock in terms of cattle, about 19 million, in terms of sheep and goat and some other ruminants that are susceptible to this disease, we've gotten quite a lot of these animals, and they are actually in the hands of a free-range producers, those who are technically not sound in terms of understanding the dynamics of infectious diseases like anthrax. So we are very concerned because we have gotten not too well-developed husbandry system of production, and we're also more concerned that we've gotten crisis in the bird with the bird flu, and it's still going on. That is stretching the authorities to its limit in terms of now facing a new disease. It is a very big concern for the profession.
All right, those who have cattle, either sheep or goats, or what precautions should they be taking right now?
So this is a time where we have our antennas up, and then we must be very, very alert. The farmers, the butchers, the consumers are all human beings, and that will be the point of risk, infection for the human, and that is what we are all guarding against. So for the farmers, the basic tool here is that they should report immediately any outbreak to the nearest authority or the veterinary authorities, who should also in turn return to, report to the chief vet officer of the federation for a rapid response, early detection and early reaction system. It is also very important here that the weakest point when you look at the risk involved in terms of this infection is that it is in the human, it's in the animal health. And therefore, we've gotten very effective vaccine, and the animal health and farmers must be assisted in rolling out these vaccines for use almost immediately. It is important that we do this because we really don't have that chance treating between onset and mortality. It is always per acute. Less than 8 hours, there could be high fever, and then the animals could start dropping dead. And we are so scared that in the process of probably salvaging them in terms of slaughter, or what we've been used to doing at the rural level, not sanctioned by the veterinary authority, humans can get infected when they come in contact with the secretions from the infected animals. And that is where the concerns are. Those looking after the animals, some of us, the animal health workers, those working at the slaughterhouse, because we've seen situations where farmers will rush to slaughter, sending their animals to slaughterhouses, and then they want to just get rid of it instead of the animals dying, and then they are not getting back their resources. These categories of people are at risk, and they must be on their alert. They must be very patriotic in reporting any incidents, any suspicion to the appropriate authorities for further containment process.
All right, speak to us about regulation. When it comes to some of the abattoirs we see and those who butcher and kill animals, that the level of hygiene sometimes is a thing of concern. In fact, there are reports sometimes where we hear that animals that are sick or animals that are dead, are taken to the abattoir to just, and then are put into this through the system and distributed. Talk to us about the regulation for that. How is it going, and how sure are Nigerians that the meats they go to the markets to buy and eat are actually clean from diseases?
So regulation, you are very correct, and that is why I said in the beginning that the veterinary services is actually being overstretched when it comes to dealing with some of these highly infectious diseases that affect man, zoonotic diseases. We've been on with avian influenza in the last couple of years, and it has actually not been able, we have not been able to contain it. And now with this highly infectious disease of anthrax, there is that need that all the slaughter facilities, the slaughterhouses, the abattoirs are manned by qualified vets who actually understand this. Unfortunately, the number isn't there. You have very few numbers of qualified veterinarians working in some of these facilities. So no matter how good the regulations are on paper, implementations are always will not be there, because those who will be able to apply them are just not there. And that is why public education, enlightenment of families or workers at slaughterhouses, at the farm level, but also the animal health professionals will have to be on a high, will have to be improved on, because you could pass an animal for slaughter not knowing that you are dealing with this deadly disease. And it is therefore important that when we talk about regulation, we also look at those who should be implementing those regulations. They are there. We've gotten inspectors in our slaughter facilities. Unfortunately, they are not adequate. A situation where you have an abattoir slaughtering and processing over 1,000 cow and then over 2,000 sheep and goat, the small ruminant, with only 2 to 3 vets, that cannot do anything, because if you look at the pace at which the butchers do this processing, you really will not have the opportunity of clamping down on any breakdown of the laid down regulations.
Okay. All right, we have to leave you here now. Dr. Bala Muhammad, a member of the governing board of the Veterinary Council of Nigeria. Thank you very much for speaking with us.
Thank you so very much for having me.
Great.